Today's topic is salt, the forgotten silent killer. This is our disclaimer. As we know that I am not the medical professional, but we have researched in depth the work of scientists and medical professionals. And this entire series is based on this research. We always hear about sugar, that sugar can cause diabetes or sugar is a culprit or a very dangerous element to cause diabetes. And we rarely actually hear about salt. But salt can cause diabetes. In the short term, when you have more salt, your brain makes you thirsty to balance the sodium-potassium ratio. Do you ever wonder why the pubs have salty snacks? Because so you drink more alcohol. As we consume more salt, we become more thirstier. Your kidneys excrete more urine to remove sodium from your body. But this is only true for the short term. What happens if you keep having excessive salt? Then your body uses a different technique. It does not make you thirstier anymore. But your kidneys use urea to conserve water, to hold back water. Now, because of that, to retain water, kidney needs urea. And liver produces more urea because kidney is demanding more urea. And as we know that nothing comes free, so liver demands more energy, more food. And in order to get more energy, you eat 20 or 30% more. And because of that, you have more glucose in your blood. To remove the glucose from your bloodstream, body secretes more insulin. And then after a while, because of the excessive insulin, cells are fed up and then they actually reject insulin. Cells develop insulin resistance. And because of that, glucose remains in your bloodstream. And when there is excessive glucose in your bloodstream, it results in diabetes. So if you are consuming more salt or high salt, then that can also cause diabetes. Now, how much salt do we need? Generally, 100 milligrams salt contains 40 milligrams of sodium. And according to our physical structure, we need from 186 to 500 milligrams of sodium per day. That's just a pinch, less than half a teaspoon of salt per day. Now, salt intake may be different for everybody, but look at the reality. We only require 1.25 grams salt per day. WHO recommended 5 grams salt per day because of our modern lifestyle. Global average is nearly twice, 9.9. In England, 8.1 gram, 8.01 gram. India over 9 grams. USA again over 9 grams. In China, nearly double or more than double. We do not need that much salt because it can cause diabetes and so many other diseases. This is the NHS UK chart. You can see as salt consumption reduced, blood pressures also dropped. In 2003, the average blood pressure was 129.6, systolic pressure, the upper one. And when the salt consumption reduced from 9.5 grams to 8.1 gram, the blood pressure also dropped. And that resulted in less deaths from 232 per year per 100,000 by heart attack to 139. That's why in Ayurveda, Charak says that salt has apparent benefits when used sparingly, but it imbalances the internal environment when used habitually or excessively. Its excessive usage causes malaise, laxity, and weakness in the body. People who use it regularly are exceedingly depressed, have loose muscles, imbalanced blood, and low tolerance bar for pain. Hence, one should refrain from ingesting excessive salt. This was Charak more than 2000 years ago. In Chinese medicines, if large amounts of salt are taken, the pulse will stiffen and harden. This was about 4,600 years ago. So, in a nutshell, salt kills. So, if we are having excessive salt, try to reduce the consumption of salt as much as possible. We must not stop salt altogether because we do require sodium, which is very important mineral for our body. It should be exactly as per our requirement.